What would it look like for you in 2025 if you didn't have a Medicare Part D prescription drug copay at the pharmacy counter anymore? Or if you're paying thousands per year for those drugs and you've never even had to take out your credit card or your checkbook to pay for it. Well, in 2025, because of some of the massive changes coming to Medicare Part D and because of the Inflation Reduction Act, you have that option, and it could be an absolute game changer. Hi, I'm Adam Simon, founder and principal of Simple Senior Health Plans, where my entire heart and mission is to make Medicare simple for you and for anyone you know. So if this video blesses you in any way, please share it with somebody who needs it, and then hit that thumbs up button to let me know you were here. So some of the biggest changes we've ever seen to Medicare Part D are going to be coming your way in 2025 because of the Inflation Reduction Act. And whether it's new premiums, deductibles, or changes in copays, every single person that has a Medicare prescription drug plan, including you, is going to be affected. And two of those changes are actually pretty massive. They piggyback on each other because of the Inflation Reduction Act that was passed in 2022. There's actually a lot that's going to happen in Medicare in 2025. And because of it, I did an entirely separate video on that I'm going to link in the description below, so you can check that out after this one. But these changes specifically are laser focused on Medicare Part D drug plans and on helping to save and protect you as far as your total out-of-pocket costs, especially if you're on some of the really expensive drugs that are out there. Now, I'm going to get to the major change about paying at the pharmacy in a second, but the first thing you need to know is that due to the Inflation Reduction Act ramping up into full effect this next year, the one thing that everyone kept whispering about the last couple years is actually going to happen. Your total out-of-pocket costs for prescription drugs on any Medicare Part D plan is indeed going to be capped at $2,000. I mean, that's a huge win, a massive cost savings for a lot of people. In fact, I have clients right now, some of them are paying $5,000 to $6,000 for their prescription drugs because of some of the higher medications that they're on. So I know how much this is going to impact people. But remember, with every win, there comes a loss, right? So every cause has an effect. So the question is, if millions of people who are paying $4,000 or $5,000 or even $6,000 for their drugs, they're now capped at $2,000, who's going to pay for that other $3,000 or $4,000? I mean, you probably already guessed it, right? Everyone else is going to pay for it. So costs are going to go up. And again, if you want to know the full scoop on that, you want to know the full ramifications, you can watch that video linked in the description below. So in addition to the $2,000 cap on out-of-pocket costs for prescriptions in 2025, CMS, the Center for Medicare and Medicaid Services, is going to implement what they're calling the Medicare Prescription Payment Plan, or MPPP for short. And what it is, it's this brand new program specifically designed to help people on high-cost prescription drugs. You know, the Eliquis, the Ozempic, Xarelto, Trulicity, all kinds of drugs like those. And it takes your copays and it spreads them out monthly instead of having to pay them all at once up front at the pharmacy. So instead of having to potentially pay all $2,000, that new cap limit, up front and out of your pocket, you're going to be given the option to spread that out over the entire year or over the rest of the year, depending on when you entered into Medicare. So the best part is that you can pay it directly to the plan. You don't have to pay it at the pharmacy counter anymore. So how does it work? Well, first, you need to know it's available for everyone and anyone on a Medicare Part D drug plan, meaning it doesn't matter if you have Medicare Advantage, where the drugs are already built in, or if you have a Medigap plan with a separate standalone prescription drug plan. So it's offered to everyone. The second thing to know is that this program's completely optional, meaning you can opt in at any time, you can opt out anytime, or you can do it multiple times a year. So a lot of people, they might change their mind if they don't like the program, or, you've probably experienced this. You change a medication throughout the year, or you add a medication. So this program's totally flexible. And if you're someone who qualifies, your Part D plan, the actual insurance company is going to notify you. So they're going to be the ones to reach out to you and let you know that you qualify. And then once you sign up, your total prescription drug costs are going to be spread out through the entire year in the form of monthly payments to your plan. So you never have to pay at the pharmacy counter again. So if you're someone who likes to know exactly what you're paying and you have fixed expenses every month that you want to be set, this might be a perfect option for you. But one of the most important things that you need to know about this new MPPP option is that this does not change how much you pay for your drugs overall. All this does is that gives you the option to budget for them and spread that same cost, the same cost that you're already paying, you spread it out over the entire year instead of paying a massive lump sum amount at the pharmacy. And lastly, if you pay a premium for your drug plan, like most of you do with your separate standalone Part D plan, if you have a Medicare supplement, you're now going to pay two bills instead of one every month. So you're going to pay one for the plan like you always do, for your premium, and then you're going to pay one for drug copays, which is new through the MPPP. So now let me recap it and put it all together. Number one, the Medicare Prescription Payment Plan, or MPPP, gives you the freedom to no longer have to pay massive lump sum amounts for your prescription drugs at the pharmacy. It's spread out monthly instead of paying at the counter. Number two, it's optional. It's available to everyone if you qualify. Number three, you're going to be notified by your plan if you qualify. And number four, maybe most importantly, it doesn't change what you pay. It just spreads out the cost. This is going to be a massive help to a lot of people. So I'd love to know if you're going to take advantage of it. So let me know by leaving a comment in the comment section. And if you want to know more about the whole Inflation Reduction Act and how it all comes together and how it affects you, watch this video next.